Hi, and welcome to the Breastfeeding Medicine Podcast. I'm your co-host, Dr. Ann Eglash. I'm a clinical professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health and a board-certified lactation consultant. This podcast is produced by the Institute for the Advancement of Breastfeeding and Lactation Education and is co-sponsored by the Academy of Breastfeeding Medicine. Hey everyone, it's Ann here, and welcome to our podcast. Today we're dedicating our podcast to the issue of donor human milk. And I have several guests today here from the Human Milk Banking Association of North America who are going to share with us a great deal of information on how the nonprofit human milk banks here in the US and North America have been impacted and are responding to the COVID-19 pandemic. So first I want to introduce Lindsay Groff, who is an MBA and the executive director at Habana. Lindsay's dedication to helping medically fragile infants is inspired by her own experience as a mother and milk donor during her daughter's extended NICU stay. Formerly the executive director of the Barth Syndrome Foundation, Lindsay has an MBA from Rowan University and a bachelor's degree in marketing from Vickers University. Hi, Lindsay.
Hi, Ann. Thanks for having me.
Yeah. And then our next guest is Amy Vickers, who's an RN in IBCLC. She's currently the president of the board of directors for the Human Milk Banking Association of North America. Amy is the executive director of the Mother's Milk Bank of North Texas since it was founded in 2004. She's an RN with a master's degree in nursing and healthcare leadership and has a certificate in nonprofit leadership. The Mother's Milk Bank of North Texas has grown to serve more than 130 NICUs and dispense more than 4.5 million ounces of donor human milk from more than 11,000 donors. Amy is also a researcher in the use of donor human milk. Hey, Amy, how are you?
Hey, Ann, thanks for having me.
Yeah. And then our third guest is Kim Updegrove, and Kim is a registered nurse and certified nurse midwife and the executive director of the Mother's Milk Bank at Austin, and she's been with the Milk Bank since 2002. Kim is a past president of the Human Milk Banking Association of North America and currently chairs the Guidelines Committee, which helps to ensure quality control of donor human milk and cultivates the development of nonprofit milk banks. So I'm sure we're going to talk to her about some guidelines. Hi, Kim.
Hi, thanks for having me.
Yeah, thanks for being here. And Summer Kelly. And Summer is a registered nurse, a board-certified lactation consultant, and a co-founder and executive director of the Mother's Milk Bank of the Western Great Lakes. She's also a researcher with a master's degree in biology and is dedicated to the biomolecular science of human milk. She also serves in Habana as the chair of the accreditation committee and as treasurer of Habana. So welcome, Summer.
Great to be here.
Yeah, thanks. So Lindsay, let's have you start out. Tell us about Habana and the time of COVID-19 pandemic.
I will. Thanks, Ann. So first I'll start by just saying the acronym because sometimes people need that. So Human Milk Banking Association of North America is a mouthful, so we'll be referring to it as HIMBANA. And what we are is a network of 29 nonprofit member milk banks in the United States and Canada. We currently have 26 members in the United States and 3 in Canada. And all of our members follow strict safety standards in order to become an accredited member. And you'll hear more about those standards a little later. I wanted to share with you that we had a record number of ounces dispensed. In 2019, our members collectively dispensed almost 7.4 million ounces, and that is over or just about 1 million ounces more than in the prior year.
Great. Excellent.
And today I particularly wanted to stress about how we take safety very seriously, and we'll get into the details from our other panelists that you introduced. But for over 3 decades, HIMBANA has continuously reviewed and updated screening practices, addressing all the latest diseases and potential risks to our patients. And now with COVID-19, of course, we continue to use the best scientific evidence available from trusted sources like the CDC and WHO to ensure that pasteurized donor human milk remains safe for the most vulnerable infants. And one thing I wanted to bring to light also is to make a note that when we talk about infant feeding and maternal health during COVID-19, we should also consider how racial and health inequities disproportionately affect Black, Indigenous, and people of color. And we're working with our partners to shed light on these issues and help to ensure safe pasteurized donor human milk reaches the babies who need it most. And our members are all dedicated in doing that as nonprofit donor human milk banks.
Yes, I think that's an important issue because we know that one of the highest risks for infant mortality among babies of color is prematurity, right? And this is where donor milk is so important for those populations, for not only reducing the risk of death, but morbidity from things like short gut syndrome.
Yes, absolutely. Thank you.
Mm-hmm. Yeah. So, okay, well, let's dive in and talk a little bit. So first, as you all know, the Center for Disease Control just came out, I think yesterday or the day before, with their interim guidance on breastfeeding and breast milk. So we've had sort of chunks of information, and now they just updated it. And in their update, they mentioned that although we don't have evidence on pasteurization and SARS-CoV-2 virus that causes COVID-19, other similar viruses have been inactivated by pasteurization. So do we have any more information to share? Any studies that you're aware of? Summer, can you share that?
Yeah, actually, there's a great study by Chin et al. That was published in Lancet Microbe. And this study looked at thermal deactivation in SARS-CoV-2, which is the virus that causes COVID-19. And they found that the virus is completely deactivated at 56 degrees Celsius for 30 minutes, which is great news to us here at Himbana because we utilize the Holder method of pasteurization. We actually hold milk at 62.5 degrees for 30 minutes, well above the threshold for the destruction of the virus that causes COVID-19. So we were pretty happy about that article, and there's a lot of studies being conducted right now. We're aware of some studies out of California and other locations that are looking specifically at human milk and pasteurization, so we will keep you posted on those results as well.
Perfect. So essentially what you're saying is that when the donor milk comes to the NICUs or the floor, whoever is using that donor milk, we don't have to worry about the virus being in the milk. There's no evidence that that virus is in the milk.
Absolutely, yes. There's no evidence that SARS-CoV-2 is transmitted through breast milk, through the outside of the containers, or really through any type of breastfeeding activity, with the exception of direct person-to-person contact transmission. There's no evidence that it's transmitted through bottles or through direct breastfeeding or through donor milk. So that's great news for all of us in this field.
Perfect, yeah. And so I have a question about milk banks and businesses. So milk banks are considered essential businesses because it's food for young babies and it's survival for young babies. So obviously there's some issues with social distancing and changing your practice. So I'm wondering, Kim Updegrove, can you share what your bank has been doing regarding the social distancing issue?
Sure, and I'd be happy to address that. As everybody knows, on March 5th, World Health Organization declared COVID-19 an actual pandemic. And on that day, milk banks were already prepared to identify themselves as essential businesses, to emphasize with their staff that milk still had to be collected and processed and dispensed so that we could save lives of very vulnerable babies. So immediately, in order to keep social distancing in place in a way that would protect the milk and the facility and therefore save lives, we immediately had to dismiss all students and volunteers. So none of those people who would normally be found in the milk banks could enter. For the staff themselves, we instituted the 6 feet of distance. So we modified our labs and the processes around the office so that we were wearing masks all the time, not just in the labs, and we were separated from each other. We also said immediately that that recipients and donors who were coming to the local milk bank didn't come into the facilities. So they called from their cars, and one staff person would go out to meet them with a mask on and either get milk that they were donating because they were already an approved donor, or give them the donor human milk they were picking up for a recipient baby in their family. We were keeping track of everybody's social circles. So staff are lectured about how to limit the numbers of people in their individual circles. And then we share that information so that if someone were to become positive with COVID-19 within the milk bank, all of the social circles of the collective staff in the building could be identified and notified.
Great. Okay. Yeah, that sounds like you have it all figured out. It's challenging. It's people want to hug each other and shake hands, and we see this in our office too, that we try to stay away from each other. Anyone else have anything to add about anything that you've done? I imagine some people are working from home too, like the donor screeners and.
This is Amy. So we are doing very similar things to Kim, with the exception of we have cross-trained our staff and have divided our staff into 4 bubble groups, kind of. So we've got a group that are exclusively working from home that are cross-trained to do all other tasks. So they're the emergency group that if everyone else is out, then this emergency group can come in and keep the milk bank running. And then everybody else has been separated as well. So we have 4 groups of people that are all cross-trained to do donor screening and pasteurization, which are our 2 big functions that are going on at the milk bank.
Mm-hmm. And I assume that you just don't have anyone come to work if they're feeling ill, right? Just like
right. We have a decision tree for health of our staff that we apply to make decisions regarding whether they're safe to work or not.
Yeah. So one of the reasons that we're doing this podcast is that people have had questions about milk banking in the time of the pandemic. And I'm wondering if you could share some of the questions that you've received by phone or by email or whatever about your milk bank. I don't know, Amy, do you want to start with that?
Sure. So the questions have sort of changed over the weeks. The early on questions were, of course, immediately from our recipient institutions and parents wanting to know, what does this mean for the safety of the milk? And so those were originally the first questions. And then the next wave of questions was, is there going to be enough milk, about supply? And so those questions then are addressed in the next week. And then following up with questions from potential donors wanting to help, but also wanting to keep their family safe and not leaving their homes to donate milk or have lab testing done, those sort of things. So I would say that those are the biggest questions that we've addressed.
Right. And I suppose along with that would be the issue of the depots, because there's been cutting of staff, furloughs, people that maybe were responsible for the freezer and then are not maybe there anymore, or the depots closed because of the...
That's true. The majority, I would say at least half of the depots across North America are in healthcare facilities. And so healthcare facilities act as a volunteer agent for milk banks and simply collect milk at their facility. So a lot of times this is outpatient lactation support centers in hospitals, NICUs, and other institutional type volunteer groups. And so if they're in a healthcare facility, a hospital, then they're not allowing extraneous people to come in. And so those depots are closed.
Mm-hmm. Yeah. Any other thoughts about that from any other milk banks? I'm wondering, So in addition to difficulty with getting blood screening, just mothers getting their milk to the depots in order to get the milk to the milk bank. How have you guys worked around that?
Hey, and I can add a little bit to that. We've been experiencing depots who are modifying the way that donors drop off their milk by having contactless drop-offs at the depots, much like we have at the milk banks. So the donors actually notify the depots of the time frame they are likely to arrive, and then when they get to that hospital or medical center or doctor's office, they call up to the lactation office or whomever is available to come meet them. And then someone from inside the facility comes out and picks up the milk from the donor, so that, as Amy said, the donor has no interaction with the facility. So she's not at risk and she doesn't expose the facility either.
Mm-hmm.
We've had a number of interesting queries from volunteers who no longer are allowed in the milk bank, but who are willing to help out those donors who just cannot break the shelter-in-place rules or cannot feel comfortable bringing the kids that are now home from schools or daycares to a facility to drop off their milk. And those people, we call them porch angels, they're voluntarily going to people's residences at a specific time so that the approved donor is putting her frozen milk on her porch a minute before the volunteer arrives. Then the volunteer picks up that milk and brings it to a depot, him or herself, or to the milk bank. So our Porch Angel program has grown out of this.
Oh, that's really cool. Yeah. And then Summer, I think you and I have talked about actually shipping boxes directly to some of the donors, especially in Wisconsin. We have people that live, you know, in places where they don't, it's very long drive, like maybe 4 or 5 hours to get to a depot if their closest depot is closed.
Yes, we formalized our shipping program. So we have a really simple process where we send the donor a box, an insulated styrofoam cooler box, and it has this really cool, it's called Techni Ice, and it's this, they're like little pillows that you get wet and then you put them in the freezer for 24 to 48 hours. And they are amazing. They work better from our experience than like those gel ice packs or dry ice.
Wow.
It's very, very easy to use. The donors don't have to go and try to find dry ice. They just simply can do all of this in their in their home. So they stick the freezer pack in the freezer, they load up their box, and then we call and schedule the pickup. So they don't even really have to leave their house. They get the box ready and they put the milk in there, and then UPS or FedEx would come and pick up the milk. It's a really great program. And it really helps donors so that they don't have to leave the house.
Excellent. Great. So people who are interested in donating, who are worried about leaving, maybe this is an option for them, especially when their partners say, could you please get the milk out of the freezer?
Right, exactly.
Yeah. And what about, so since we're talking about donors, Summer, can you talk about what any kind of advice you give to people when you are doing the donor screening now regarding what to do if they do have respiratory symptoms and they're active donors and they're approved donors?
Yeah, that's a great question. So our standard precautions cover that. So every Himbana milk bank has a food safety plan, and in the United States, milk banks are mandated to operate under the Food Safety Modernization Act through the FDA. And what this means is that we identify 3 hazards at every step in our process. So we identify biological, chemical, and physical hazards and how we can prevent those. We know that human milk has bacteria and viruses in it, and all of our systems, all of our procedures are set up to protect our staff as well as our recipients from acquiring any type of infection due to a bacteria or virus. So luckily, all of these precautions are already in place. Specific to COVID-19, we are concerned about our staff and about the family and society at large. So we do have a temporary 28-day deferral. It's at least 28 days. And that really is a mechanism to protect our staff and society from the donor needing to leave her house or her family members needing to leave her house to drop off milk or to get blood drawn. We don't want anyone in the family to, further the spread of COVID-19. So we have a deferral in place, which can be lifted after the donor is no longer infectious. And I did just want to address that it is inconceivable that milk banks would somehow be able to screen out 100% of COVID positive or suspected moms because there's so many asymptomatic carriers of this disease. Luckily, all of our processes, including our kill step of pasteurization, which destroys coronavirus, all of those are in place to keep the milk safe. So we do have a temporary deferral, but that's just to protect the staff and society at large and the donor and her family. And that can be lifted after we screen for medications and other things.
Right, so that makes sense, because even if they're asymptomatic COVID carriers, they can be asymptomatic all kinds of carriers like Campylobacter, E. coli, a bunch of other germs. So those universal precautions are just going to protect them from everything, right?
Absolutely. I mean, there's thousands of potential pathogens in human milk. So we've considered those. They're in our food safety plan. We identify several viruses and bacteria that can potentially cause harm to our staff or to recipients, and we control for all of those, including SARS-CoV-2.
Perfect. Great. Okay, as you know, there was a recent article that was published in the Journal of Human Lactation that suggested that bottles of donor milk should be cleaned upon receiving the shipment from the milk bank to the hospitals. And I think they also implied that maybe, all bottles should be washed no matter what, no matter where the bottle, once the milk is expressed to the milk, wherever that bottle of milk goes, whether it's going to daycare or whether it's going to the milk bank or if it's coming from the milk bank to the hospital, that they should be cleaned. But the interim advice by the CDC that just came out states that there's no evidence to support washing the outsides of any bottles. Do you have any further guidance on this? Some people may be wondering why, this is a published recommendation, but then the CDC says, no, there's no evidence for that. And what's the risk? Like, why would we not want to wash the outsides of bottles?
Yeah, so we do not recommend applying chemicals to the outside of bottles or bags of milk. That is not safe. To our knowledge, it's never been suggested before. It's unprecedented. It introduces a significant chemical hazard, especially with the concentrations that they recommend, which is a high concentration bleach. We would never use that in any food manufacturing facility to treat food packaging or anything that was even near food packaging. In fact, the manufacturers recommend removing all food from the room that you're mixing the bleach in. This is completely off-label recommendation. Clorox and other bleach manufacturers would not support the use of their products on any food packaging, especially a food that's going to an infant or a premature infant. I think in addition to being dangerous and presenting a significant hazard, it's completely unnecessary. So that really is the crux of it. It is unnecessary and unwarranted to apply any chemicals to bottles or to bags of milk. There's no evidence that it's necessary. There's no evidence that COVID-19 is transmitted through milk or through milk containers. And we have an aseptic technique that's really simple. All you need to do is grab a transfer syringe or a bottle and simply pour the milk from one container to another if infection control is very concerned about handling milk from a COVID positive mom. And that's available on Himbana's website for free. So anybody can go to www.himbana.org. Lindsay, that's correct, hopefully. And you can download this infographic. It's a 2-page infographic that shows you how to safely handle milk from COVID positive moms. And I did want to point out that there's a lot of problems with using, high concentration bleach and other chemicals on food products, or just in general. So on April 20th, the CDC released a MMWR, which is a morbidity and mortality weekly review. And it was specific about bleach poisoning. in the era of COVID-19 and chemical poisoning. So calls to poison control went up, I think, like 20% due to COVID. And the very first case study talked about a woman who made a bleach concentration and she had to go to the hospital for respiratory distress. She used the exact same recipe that was recommended in the Journal of Human Lactation. This is not safe. Families should not be making this bleach concentration and putting it on milk bags or bottles, and neither should providers. It's completely unnecessary and it's dangerous.
Okay, yeah, that sounds like it's very evidence-based to not be doing that. Thank you so much for sharing that. I want to talk about how milk is being used in the hospitals. And so I wonder, Kim, can you just tell me what you've been noticing in Texas regarding the demand for donor milk from the NICUs? Has that gone up or has that gone down? I imagine that there might be, I wonder if like some mothers may not be able to provide their own milk as much because of issues of getting to the hospital or being COVID positive and not being allowed in the NICU, things like that.
Right, those are great questions. So I'd be happy to address those. You know, initially when the pandemic was announced, NICUs, rightfully so, scrambled to put protocols in place that would protect all of the babies within the unit and of course all of the staff as well. And some of those protocols created some barriers that were new to mothers or parents of babies in the NICU. So protocols that included reporting any symptoms that you were having, not that they were proven to be COVID-19, but you know, as we try to define the symptoms, the big category of symptoms that are seen with people who are then later tested and found to be positive, that's an ever expanding symptom list. And so NICUs had to ask parents to self-report their symptoms, and they, in order to control the number of people in the NICU at any given time, they very often limited their visitation hours, so that really they could keep track of the exposures of their staff and other babies and families to each other. So moms who were providing human milk for their own babies suddenly had these barriers in place that worked against their ability to get their milk to their babies. And then additionally, you have schools and daycares closed. So moms who could visit with their baby because their other children were in school or daycare that day, they're suddenly home taking care of their families. So it became more difficult. And so the initial weeks, we saw a slight increase in the use of donor human milk in the NICUs, but we've seen that reverse back to a more normalized volume of donor human milk across the NICUs. Typically, the Himbana milk banks will dispense about 80% of their donor human milk to NICU patients, and that's pretty much where it's resting right now. We've seen that correct itself.
Mm-hmm.
Now, there's a slight change in the way that donor human milk is utilized in other units in the hospital. So well baby units, where donor human milk has become popular as what's called a bridge provisional feeding for the babies whose mothers intend to breastfeed, but their breast milk supply is not yet available or not fully available, and their child's experiencing mild hypoglycemia or mild hyperbilirubinemia. So donor human milk is used to fill that gap. With COVID-19, hospitals are reporting that moms who are giving birth are eager to leave the hospital sooner. They're not wanting to spend the allowed time in the well baby unit. They want to limit their exposure and so get themselves and their babies home. Well, now their milk really isn't in yet because they may not experience a breast milk supply until day 2 or 3, long after their baby might need it. So what we're seeing now is, instead of donor human milk in the well baby units being in an increasing demand, now we're seeing the moms leave the hospital and need that bridge milk at home, need a bottle or 2 or 3 just to fill in the gap, keep the baby from experiencing any negative effects of the delayed lactation, and then she's able to produce her milk and take over from there. So it's just a movement of where that bridge milk is utilized from the well baby units now into the homes.
Right, right. Yeah, and I think one of the dilemmas that many people are seeing is that these families are leaving early and then not always having a place for them to go because so many doctors' offices are closed, or especially if mom wasn't tested but is a PUI and therefore the baby's a PUI or a person under investigation, right? PUI, I forget what that means. So a person under investigation, if they leave, it's going to be very hard for them to enter what's called a quote unquote clean office. And so then the baby takes the risk of not being weighed. So we've seen some in our community, some parents being told by the doctor in the hospital to just get some formula and just go ahead and just, if you have any concerns, just go ahead and supplement with formula just in case because of the difficulty in getting the baby weighed. And so I think this is an important message that for hospitals that are using donor milk on the floor, they have that system set up that this is a good opportunity to give some extra milk for these families, particularly for families who have a very high intention of breastfeeding and want to be successful. Any other comments about that? I think there has been some data collected, is that right, through Habana regarding the amount of supply and demand through the different milk banks as collectively?
Amy?
Oh, yes.
So we are...
So yes, we have been collecting data weekly from our member milk banks. And we have a really steady, stable supply of milk coming in and recipients. So we haven't really seen any big swings in supply or demand. Things are very stable for milk banks as far as supply and demand.
And I do just want to, thank all of the generous milk donors out there, the superheroes right now that are saving tiny lives and really have answered the call to help. Just like we've seen a lot of calls to donate blood and to help with blood shortages, we've seen the exact same thing in milk banking. And a lot of milk banks actually have reported an increase in donations or in donor interest from moms who really want to help. So we are so grateful for these superheroes that are saving tiny lives. And we want to extend sincere gratitude for all of our milk donors.
Very nice. That's really great. Yeah. And I think the last thing I want to talk about is just this, there's a lot of angst about the separation of mothers and babies on the floor. So after delivery, so now I think a lot of maternity floors are testing every mother who comes in, because that's actually, now that testing is more available, even anyone who's coming to the hospital who's going to be staying there is being tested, so they can kind of sort the wheat from chaff and know who's really positive and who isn't. And so so the American Academy of Pediatrics recommendation on how to manage COVID positive moms who want to breastfeed has been different than from the CDC and the World Health Organization. And the American Academy of Pediatrics has advised that mothers and babies be separated, which really we all know increases the risk that the infant may not be successful breastfeeding, or mom may not be successful in establishing an optimal supply. Now, some physicians and other staff at hospitals have managed to do shared decision-making with families and have allowed skin to skin and have allowed families to stay together when the families decide that they want to, but others have been very strict about not allowing this, which is what I'm hearing a lot about. And so what can we say to the individuals who are making these decisions about the importance of breastfeeding and why this is the last time at any point in public health that we should be taking the risk that infants are not successful breastfeeding? Why is this so important? Like what is it about breast milk, even pasteurized milk, when we know that some of the components of breast milk may be partially destroyed? Why is it still really important in these situations? Why should we be pushing to make sure that babies are being breastfed?
Yeah, I think that, The CDC and the World Health Organization's recommendation for shared decision-making is very important. And when the family makes the decision to room in, or if they make the decision to be separated, those families should be supported to breastfeed if that's what their intention was. So whether there's a rooming in such situation or a separation situation, we need to really support these families with breastfeeding. Breast milk contains thousands, tens of thousands, hundreds of thousands of components that support the infant's developing immune system that are simply not found in formula. And passive immunity is a two-step process. So the first step is IgG transfer through the placenta. So that antibody is small enough to pass through the placenta and provide the baby with some short-term immune protection after the baby's born. But that's a two-step process. The second step is receiving secretory IgA from the mother's breast milk. And these two systems of the IgG transfer followed by the IgA transfer through human milk work together to prime and develop the infant's immune system. For example, we believe that there are components in human milk that are not found in formula that develop the infant's thymus. And the thymus is what makes T cells for the baby. So this is a really important immune organ. And some studies showed that the thymus is as much as like twice as large in a breastfed baby, in a breastfed infant versus a formula-fed infant. So this is the organ that makes T cells for the baby's entire life. So human milk is so critically important, not only to protect against COVID-19, but seasonal influenza and dozens of other diseases, gastroenteritis, rotavirus, all of those things. And I know before we started, Anne, you had mentioned that unfortunately in some areas and for some families, there may be a delay in immunizations due to logistical problems or maybe clinics shutting down or something like that. Human milk does not replace immunizations, but it complements immunizations. So we really need to support these breastfeeding families so that they can get not only the antibodies like secretory IgA, but also all of the other components like the human milk oligosaccharides that not only feed the good bacteria and develop a healthy microbiome, preventing possibly necrotizing enterocolitis and all sorts of other gastrointestinal diseases. But these human milk oligosaccharides can also directly attach to bacteria and viruses like norovirus to prevent attachment to the infant's epithelial lining in the gastrointestinal system and in the upper respiratory system as well. So in addition to the antibodies, passive immunity, development of the thymus in the infant's immune system, we have lactoferrin, lysozyme, and a whole host of cytokines and growth factors that protect the infant. So it is really a public health imperative that during COVID-19, breastfeeding families, whether they choose separation or they choose rooming in, are supported fully so that the infants can benefit from this immune protection, especially now.
Right, absolutely. The last thing that a baby needs is to be exposed to COVID-19 and then also have norovirus diarrhea or rotaviral diarrhea or influenza and not have that immune protection to moderate that disease. So yeah, absolutely, totally agree with you. And unfortunately, I think that message has gotten lost and we really need to push that quite a bit. So great. All right, well, do you have anything else that you want to share or add? Otherwise, we'll have Lindsay do a little wrap up.
I want to thank all of our milk bankers around North America and the world. We are essential workers, and I am so proud of all of our milk techs and donor screeners and our folks that work in shipping and receiving, everyone that's coming in or working from home on a daily basis to save tiny lives. Thank you so much to all of the milk bankers here in Illinois and Wisconsin and Texas and all over North America. You guys are amazing. Thank you so much for the work that you do on a daily basis to save lives.
Thank you. I agree. Thank you so much. And we will be in touch with you guys.
Wonderful. Thank you.
Thanks.
For questions regarding this podcast, please contact us through our website at lacted.org. We have other educational projects, including the Clinical Question of the Week, our Little Green Book of Breastfeeding Management for Physicians, and our various educational courses and conferences for physicians and other breastfeeding supporters. If you want to see what we look like, check out our Breastfeeding Medicine Podcast Facebook page, where you can post any questions or comments about our podcasts. Thanks for listening, and we'll be back with you in about 4 weeks.